Today we're going to be talking about shoulder dislocations. Shoulder dislocation occurs when the ball pops out from the socket, creating a damage to what's called the labrum around the shoulder joint. Around the socket is a connective tissue layer called the labrum. When you dislocate your shoulder, you tear that labrum, and that creates what is called a Bankart lesion. Additionally, if you let the shoulder be dislocated for an extended period of time, a Hill-Sachs deformity or what's called an impaction injury can also occur. And that impaction injury is to the back of the ball when it rests on the front of the socket or on the glenoid. What you need to do for a shoulder dislocation is seek out treatment immediately. The longer you wait, the more difficult it is to relocate or put that shoulder back into the socket. So as soon as this occurs, talk to your coach, get your athletic trainer to put the ball back into the socket. If it can't be put back into the socket, oftentimes you'll need to go to the emergency room in order to have that put back into place. Like I mentioned, the longer you wait, the more difficult this is and the more damage that is causing to your labrum and also to the backside of your shoulder. So you want to seek treatment immediately. Once it's reduced, we recommend going to see an orthopedic sports medicine specialist in order to determine which treatment is right for you. There are two different types of treatment that you can do for shoulder instability or one that has had a shoulder dislocation event. The first type of treatment is physical therapy. Physical therapy is right for those individuals that might not be actively participating in athletics on a frequent basis or are older individuals. In those particular instances, a physical therapist work on strengthening the muscles around the shoulder in order to keep that ball centered in the socket. For individuals that are younger and more athletic and that participate in high contact sports such as football, basketball, hockey, and lacrosse, we recommend surgical stabilization after the first dislocation because after you dislocate the shoulder multiple times, the damage becomes more and more severe to that labrum and also to the surrounding structures of the shoulder. Surgery, if you do it after the first dislocation, dramatically reduces the risk of it redislocating. So for individuals that participate in those high-level contact sports, we definitely recommend having this surgically treated the first time in order to prevent it from dislocating again. However, you want to seek treatment with your orthopedic sports medicine specialist in order to determine which treatment is right for you.